Hello and welcome to Attached Together, the podcast where we explore attachment theory and what it really means in practice for counsellors, psychotherapists and psychologists. This podcast is created by the team at Optima, who deliver the Level 5 and Level 7 diplomas in attachment-based psychotherapy. This is a space designed to help you deepen your understanding, reflect on your clinical work and stay connected to the heart of attachment-informed practice. I'm Joanne Kay, your host for this episode. I'm a psychotherapist, a supervisor and trainer, and I also teach on the Level 5 courses at Optima. Now, before we begin, just a quick note, our episodes include a CPD certificate. If you'd like to access that, you can visit our website or check the show notes if you're listening on Spotify. Okay, so joining me today are two guests. So there's Lynn Coombs here with me. So Lynn is an attachment-based and person-centred counsellor, specialising in bereavement, domestic abuse, and also works with the parents of neurodivergent children and carers. And I also have Alison Cunningham, who is an integrative counsellor and works with young people, often with care experience, and neurodivergent people as well. So we, all three of us, have something in common relating to today's topic, which is we're all parents of neurodivergent children, aren't we? So hopefully that will make for an interesting discussion. It's already interesting that we're all parents of neurodivergent children and therapists at the same time. We've both got those two hats that we wear. So I'll bring you in, Lynn, first of all. I feel like this is a huge topic that we could go down lots of different rabbit holes with. And I just wanted to ask you about, your own experience of being a parent of a neurodivergent child and maybe what you feel that brings when you then work with those parents as clients.
I think for me, it's having a really good foundation and base of understanding. And as a parent, to be believed, as you say, I've got two children, both on the spectrum. One is ASD or ASC, as it's also known, depending if you want to use disorder or condition after the autism spectrum. My other child is attention deficit hyperactivity disorder. So it's always been really difficult to juggle both because the needs are very different. But it's also then given me a clear understanding that it's nowhere near the same for everybody. It's such a vast spectrum. It's like being in a DJ booth and all the little levers and nodules that they got for bass and treble and everything else, they're all set at different levels. So they're very different. So just understanding that when a parent comes in, whatever they say, it's okay and it's real, and to believe them, because I feel as a parent, a lot of the time when I was trying to explain to people how difficult it was, the trials and tribulations, you're kind of met with this like, really? Did that really happen? Or is that really that bad? Is it really that difficult? So as a therapist, I just feel that that's the important part for a parent, is to be heard.
I love that, and that really resonates with me. And it's that there's that old saying, isn't there, that if you've met one autistic person, you've met one autistic person, and that kind of goes for all neurodivergence. There's kind of collections of traits and things, but it's so unique to the person. And that there's something in there about shame and judgment, I think, around what you were talking about with just being believed is so important, which sounds fundamental in therapy, doesn't it? But there's something about that with parenting neurodivergent children. Maybe it's a societal pressure or a societal impression of what goes on for neurodivergent people, or what opinions are of diagnoses. So there's something really about providing that safe base, I guess, isn't it? Of I believe you and I hear you, and having that empathy.
Yeah, absolutely. And I think it certainly increases that level of empathy and being able to hold it in the room. As you're saying, there's lots of societal inputs that people judge behaviour, and it's our parenting that then gets attacked first. It's generally, or certainly in my experience, it was always my parenting that was attached. You need to do another parenting course, and other people just not understanding the challenges that were involved and all the decision making, even, society, when you ask for help, when you ask for a referral to look at a possible, is there something here that needs to be diagnosed? There's that whole well, he's just naughty or she's just naughty. And it's no, I think there's something more to this. And then when you get the diagnosis, it doesn't end there, particularly more so with ADHD, because there is that whole then question that opens up of medication. Should you have medication? Should you be medicating your child? I certainly ran into opposing viewpoints on that. But I loved a poem I read. I don't know who wrote it, but it explained that a child with ADHD is like every child's trying to carry 50 marbles, but a neurotypical child has a carrier bag and a neurodiverse child has a carrier bag with a great big hole in the bottom. And when they have medication, it sews up that hole a little bit. They'll still be dropping marbles, they'll still be chasing around and be a bit chaotic, but it alleviates some of the symptoms to a point where they are better able to function.
I love that analogy, the marbles. And it it really illustrates almost the privilege of being able to walk around with a carrier bag. I guess what I'm kind of applying that analogy to is almost, and you could apply it to lots of different aspects of neurodivergence, but for me, I'm thinking of kind of holding lots of different sensory stimuli while kind of going through the world, and actually it feels like everybody else can kind of hold it together, but actually I've got one marble coming from over here, one coming from over here, one coming from over here, and they're all slipping out.
Yeah, so you've then dropped your carrier bag because you've had a hole in it anyway, but you've dropped it because you're so busy picking up all your marbles.
Yes. Yeah, I love that. Great. Yeah. I feel like I'm going to use that. I'm going to take that. Yeah. I'll try and find out where that poem is from. You'll have to send it to me. So, Alison, I'll bring you in now because this is kind of relating to some research that you've done into parents of neurodivergent children.
Yeah.
Kind of from an attachment perspective. So tell me more. Tell us more about that.
So I love Lynn's analogies. So I think they're brilliant, actually. So well done. But yeah, my research was based on parenting styles and that relationship between parents and neurodivergent children, looking from the attachment style. And I think at the time, I was asking for a personal reason as well. And I think most parents of neurodiverse children kind of go through this. I mean, I'm a little bit lucky. Mine are older now. But did I parent the right way? Did I give them what they needed? Or did my own stuff kind of step in now? So, I was kind of looking at if you've got an avoidant or a secure attachment, how that would impact your parenting stress levels. And overall, I think that it became a lot bigger. I think it became a lot more about, like you were saying, society, the support out there, cultural differences, and all these other elements were kind of coming in. And what I resonated with a lot of it was actually you can have an avoidant or a secure attachment. And yes, it will impact you slightly, but it's more those external factors, that lack of support, that lack of understanding, that lack of accept that impacts the parent more. That they're trying to, understand their own child. And it's interesting because when I see it come in the room from parents, I think sometimes, not always, but one of the questions is, did I kind of do something to bring this on with my child? Did I do the perfect pregnancy? Did I do this? All these questions. And actually kind of looking at that from the attachment side, where's that kind of come from, and giving them the space to actually work through that and recognise that there are times, and I say this to a lot of parents, you will always love your children, always, but there's times maybe you don't like what they do. We always love our children, and society tells us we should love our children. And yes, but sometimes we're not overly proud of the behaviour, the stigma that comes along with that when you're trying to do your weekly shopping, or you've suddenly been called to the street teacher again, and all of these things. And kind of working on this research, I think the attachment fell quite far behind, and it was more about, like I say, how society kind of treats parents of neurodiverse and that expectation that's put on parents to be a good parent, whatever that looks like. giving parents the space to recognise that attachment, how that attachment might come in regards to their response. So as the child's behaviour is getting worse, their stress levels kind of escalating and how they feed into each other. But more so recognising all these external factors and how that impacts the parent. And for me, like Joe was saying, listen to their truth, but also allowing them the space to sometimes say that they're not enjoying this. The other side of actually, no parent, I think, actually goes into pregnancy going, I would like a neurodiverse child. So they're kind of going through that grieving process themselves as well of what this perfect baby would have been, of what they're kind of living with. And they're almost doing that because as the child gets older and that neurodiversity comes out in different ways at different stages, it almost feels like they relive that again and again and again. So for me, it's about giving them that space to really sit and kind of say, my experiences impact me this way, but actually, I don't always enjoy every element of this. And I feel having the space to feel that that's okay to say is really powerful as well. So just kind of adding on what Lynn was kind of saying now, because, acceptance is brilliant. But I also think that non-judgement, that real open space to say both sides of being a parent.
Yeah. And like you say,
Sorry, go on.
That isolation from society and that impact, because I certainly experienced with the behaviour that the children are expressing, you do become isolated from your own peers and sometimes your own family members because they don't want it. They don't want to be around those behaviours, or they're finding it embarrassing or hard to manage, don't get as much, perhaps maybe relatives or friends don't want to offer some help to look after your child so that you can attend an appointment, or there's not many people that will step forward and be like, do you know what, if you need to go and do that, or if you need a break, I'll look after them for the day. You go and take care of yourself. So you've got that added isolation on top of your grieving what you hoped parenthood would be.
Yeah. And there's something about as well, I mean, there's loads in there that we'll come back to, but there's something about, because often we can become the person who is solely attuned to that child, that kind of narrows that circle of them being independent, but also them being able to go with somebody else for a bit and give us a break.
Yeah,
as well.
The village to raise a child, our village is very small.
Yeah.
It kind of takes away that saying, isn't it? It takes a village.
Yeah.
Because when it becomes neurodivergent, that village becomes very, very small.
Yeah. And I just wanted to come back to as well, because you both kind of touched on that societal kind of blame that can, even if nobody's saying it, someone might be literally saying it, but it can feel like it's kind of there, the judgment of you as a parent, and then that being internalized into self-blame, like you were saying, Alison, is there something that I did wrong early on? Am I not controlling or parenting this behavior correctly? Is this all my fault? So it's kind of coming from outside and then can be coming from inside as well. And it's making me think about, attachment theory and being an attachment-based therapist, and thinking we've actually got to be really careful about how we see what good attachment or healthy attachment or secure attachment, what that looks like, because it can look very different in a neurodivergent family or a neurodivergent caregiver-child relationship.
Massively.
And it's certainly,
and I think it's fundamental that you're aware of it. But again, I think we're looking at it from that unique perspective, because at the end of the day, you can have a really secure attachment, but then having a neurodiverse child, does that shake it a little bit? Does it kind of make you start second guessing stuff and stuff like that? So I always look at it from that almost that existential point of view. It's that phenomenology, it's their experience and where they're kind of coming from. But it's funny when you were talking about whether we hear that message, explicitly or not. I think there's a lot of education that needs to be put out there to a lot of professionals. One thing I always remember, and I'm going back, like I say, my eldest is now 30, so I'm going back to primary school, and always kind of waiting outside the classroom for your child to be brought out. but the teacher standing at the door and almost doing this to me, calling me to the front. And so all the parents would know straight away, oh, her son's done it again.
That's such a familiar
And it's that
familiar scenario to me, Alison. Don't know about you, Lynn, but I'm relating heavily to that.
It just feels like a walk of shame. You're like, oh, here we go. What's he done? But it's even silly things like that kind of reinforce those feelings that we have as parents.
Yeah, that feeling of my failing as a parent, because you start to compare. It's a natural thing. We all do it. You start looking at other parents and how their children are behaving. They're following instructions. They're disciplined, and you start questioning, well, where have I gone wrong? And people might not have seen what's occurred prior. My son was mute until he was 4. We utilised Makaton and sign language. And so to know what he needed and the frustrations that he would express very physically were a real everyday thing, because he got so angry and so frustrated. That attachment and having to be so attuned, being able to read him, being able to anticipate, because that's the other thing. I think we live in that anticipation of, okay, that's might happen. That's going to start off that, and you're firefighting all the time.
But I think you develop a sixth sense, don't you, with your children? You kind of, I used to say with mine, there was a perfect moment where you could step in. I mean, all of mine are on the spectrum, but my middle son was also ADHD and Brett. So he would have the explosive outbursts. And I used to say, if you caught him in that moment, you could de-escalate very quickly. But if you missed that moment, you missed that look, you had to ride the storm out.
Or if somebody interrupted and then pressed the big red button that sent it going.
Yeah.
It's like, no, just leave me to deal with it, please.
Someone trying to help.
Yes.
But yeah, because you tune into your child, don't you? Massively. And I think that's really underrated for neurodivergent parents, how in tune they become with their child. And that, I kind of look at it as a superpower for parents with neurodivergent children, because they're a lot more, in some cases, a lot more attuned than parents with neurotypical children.
Yeah, because it has to go way beyond language.
We're like the SAS version of parenting.
I like that, Lynn. Yeah. Love that.
Yeah, as long as there's no mud to go through. And
sometimes there is. Sometimes there definitely is. Okay, let's have a little break and then we'll come back and do our dilemma.
Do you ever sit with a client and feel there is something happening beneath the story they're telling you, but you're not quite sure how to put it together? Well, that is where an attachment lens can change your practice. Our CPCAB Level 5 diploma in integrating attachment-based psychotherapeutic counselling into clinical practice is designed for qualified counsellors, psychotherapists, therapists who simply want to move beyond attachment theory and learn how to actually use it in the therapy room, to notice patterns, to make sense of relational dynamics, and feel more confident about what might really be happening between you and the client. We are currently accepting applications for our September cohort. Search Optima Attachment Training Level 5 and take a look. It might just change the way you see your clients forever.
So this is the dilemma part of the podcast that we'll go into now. So we have this regular dilemma feature where we take a hypothetical scenario and just use it to think through what that might look like in the room and what we do in that therapist's shoes. So this is our fictional dilemma. So a client says parenting their neurodivergent child leaves them constantly overwhelmed, guilty, and afraid of getting it wrong. Kind of links to what we've been talking about, doesn't it? They spend much of therapy talking about their child, but struggle to identify their own feelings or needs. So you're both nodding, like, relate to this one maybe. And I guess, it's kind of how do we work with that? Because certainly for me as a neurodivergent parent, I know that talking about that and talking about my child does take a up a lot of my personal therapy space when I have personal therapy. And I guess it's how do we keep it focused on that client, that parent's feelings without, and I guess this is especially relevant to us as we're also parents of neurodivergent children. I guess the danger is we get lost in kind of being there with them, in being a parent in a way that shifts focus onto what's going on for the child and trying to get to the bottom of that rather than what's going on for the client.
Yeah, I think for me, it's about kind of understanding, is there something preventing them? So, i.e., you know, if we go back, like I say, to that societal expectations and this, that, and the other, how are they actually feeling about being a parent of a neurodiverse child? You know, they might not actually be sitting too comfortably with their own feelings around it at the moment. So I think for me, it's kind of allowing them to know that all feelings are welcome, you know, and almost explaining that as parents, any parent on the planet, we can all have very mixed feelings towards our children. And so almost introducing that space to them for what the purpose is for, and building that relationship and that trust up. And hopefully that would kind of then, you know, through that experience, they do start to kind of hone in. But sometimes it is just about listening, sometimes about what their child's experiencing. So that's almost out of their system.
Yeah.
So then they can then focus on themselves.
I was thinking there, it's very much like transferable skills in the sense of, you know, being so attuned to our children. We're looking out for so many different things. It's what sounds are there, what smells are there, what the weather's doing, what their body temperature is. There's so many different things. And I think when I'm with a client, it's kind of not excluding anything, but being aware of everything, trying to, like you say, build the relationship. So encourage the relationship in the sense of it's a safe place. And if they want to talk about the child, if that's their need, sometimes we need that safe space to actually, because I certainly found as a parent, I would edit what I told other people. I would sugarcoat it a little bit because I didn't want people to know the real brutal reality of perhaps what I was going through or witnessing with my child. So to have a space where you can actually just be real, and I often find as well reassuring parents that, or anyone in my room, I don't mind what language you use. I want you to use the language that makes sense for you because I need to know it in your words. If that means swearing, then swear. As long as it's not directed at me in an abusive way, that's fine. And sometimes the relief that comes and they can just like start expressing how it actually really feels and be angry. Anger is also one of those emotions that we're very much taught is a wrong thing. And it's not to be expressed, but it's not. It's about how it is expressed. It's very important. You know, it's part of our attachment survival strategy as well as other emotions, in inequality to other emotions and allowing that. And what's also coming to mind for me is the name it to tame it.
Yes.
So actually allowing that space to talk about the child allows the processing of all of that. And therefore, once you've built the relationship, once they've started processing those experiences and how they fit, the feelings will come. And I think it's being patient and sitting with them in that and then explore the feelings.
I think it's also worth pointing, you know, as counsellors, we're not just hearing what they're saying, you know, so they can be verbally talking about the child and this and the other, but actually we're looking at the body language and that gives us a huge indication about, you know, how they're feeling around that. You know, if they disappear in the chair, if they kind of start almost kind of coming up, and we're looking at all those different cues. So we've got a real understanding of what the feelings are behind it. And we can kind of use a bit of immediacy in the room in regards to, I'm noticing you're talking about this, your child's experience here. I actually noticed how you was when you was discussing that. So kind of bringing that in to show them that we're not just hearing the words, we're seeing them, the whole picture for them.
Yeah, and it's that superpower again, isn't it? Of we know how to catch a moment. We know how to be attuned to other signs of dysregulation and things going on under the surface. We've got an eye out for that all the time, haven't we? So yeah, it's really, and what you were saying, Lynn, was around just allowing that space for the full spectrum of emotion without shame. Shame's massive here, isn't it? That and societal pressure.
Yeah, and I think as well, there's an element of bringing in that that it's normal to have a combination of emotions. You can have very much joy and pride in your child and still be distressed and guilty. And we are able as humans to have simultaneous opposing, conflicting emotions.
So it's like a space to hold both. And, anger doesn't mean bad parent. Mourning for the expectations that you might have had that didn't happen doesn't mean you don't love your child and everything that they are. It's kind of, being able to hold both sides of that seesaw.
I also think it's about allowing that space for them. I think for a lot of parents, you've got that added layer as well, that they're not just trying to navigate their way through their feelings and experiences with their own child, but also professionals and all of these other people. So I think that also adds another layer, and being able to, because at the end of the day, if they're feeling a lot of ways to a lot of other professionals, they're now sitting in front of you. Almost trying to, yes, it's a professional relationship, but you're coming at it from a different angle. And that can be a barrier, but also a place to start breaking that down.
And also being mindful of the impact it has on relationships, significant relationships, be it with your partner, your husband or wife or immediate family.
Or even other children.
Yes, siblings, and your relationship with the siblings and them and their relationships with their siblings.
Yeah. I think for years I was told, "Oh, Patrick's your favourite." Patrick wasn't my favourite. He was just the most. He was the loudest. So to a lot of people, it felt like, it seemed like he became my favourite. He wasn't. They just needed my attention in very different ways.
Yeah.
But people don't see that, and sometimes the children don't see that either. So massively the relationship.
Yeah. Okay. Well, we're kind of coming to an end now. And I wonder, I might ask if you want our listeners to leave with something from this conversation, what would you leave them with at this point?
Doing amazing. And that's it. We can only do what we can do. But always be known it's the best at the moment.
Thank you, guys. I think that draws us to an end on that wonderful note. Thank you for joining us today on Attached Together, and we'll see you next time. If you'd like to learn more about our Level 5 and Level 7 diplomas in attachment-based psychotherapy, you can find full details at optimaattachment.co.uk, and that's also where you can download that CPD certificate for the time spent listening to us today. And this is available for all of our episodes, so do go and check them out. If you're listening on Spotify, there's a link in the show notes as well. Thank you very much. Goodbye.